WETFLAG is a mnemonic used to make essential calculations of drugs and interventions when you are faced with a sick child in the emergency room. Now, the WETFLAG stands for weight, energy, ET tube, fluids, lorazepam, adrenaline, and glucose. You will see that central to all the calculations is weight. And in a sick child, you have to estimate a weight rather than have standard doses of drugs like an adult. Now, one formula that you can use to estimate a weight is given as per EPLS, which is double the age and then add 8. Now, that is the weight in kilograms. For example, a 10-year-old child with this estimation would have you double the age, which is 20 plus 8, so roughly 28 kilograms. Although in practice, most 10-year-olds would weigh around 30 to 35 kilograms. You also have to agree by a visual look, and the team could agree at a weight, because all the further calculations would be based on the essential estimated weight. It is easy to under or overestimate the weight and get all the calculations wrong. You could look at the recent clinic records on your hospital computer to know if the weight of this child is already known. Now, this formula is only valid from 1 year to 10 years age. The other system from APLS gives 3 other formulae, but in practice it's hard to remember those, so best to keep one in mind. If a child needs defibrillation, then the energy setting on defibrillator has to be estimated by this formula of 4 joules per kilogram. You may not have exact number that can be set on your defibrillator, so you have to round it up and not round it down. For example, a 10 kilo child, you may not have a 40 joule as a setting, so you might have to turn your dial to a 50 joule. An ET tube is inserted usually by an anesthetist or a PICU doctor. The size of ET tube is calculated as age divided by 4 plus 4. Now, always remember to have one size up and one size half size up and half size down for the ET tube. Now, length of insertion at lips is estimated by half of age plus 12, but you don't always need to remember that. It is helpful after insertion of ET tube to confirm equal air entry on both sides. It's also helpful to note down the length it was originally inserted so that during subsequent resuscitation the ET tube is not dislodged. X-ray has to be used, chest X-ray has to be used to confirm the ET tube position, which should be just above the carina. Fluids, a calculation of fluid bolus is 20 milliliters per kilogram, and the fluid type is normal saline. In some situations, you would consider a smaller fluid bolus. For example, in trauma or in DKA or in a small child, you would just use 10 milliliters per kilogram as a bolus amount, which can be given quickly even through an intraosseous route. Now, some drugs, dose of lorazepam is 0.1 milligram per kilogram. Dose of adrenaline is 0.1 milliliters per kilogram, but it is a weaker strength, 1 in 10,000, and you are giving it IV. Remember, in anaphylaxis, a stronger strength of adrenaline, which is 1 in 1,000, is used, and it is given intramuscularly. So you are giving IV adrenaline at this calculation as part of resuscitation, for example in asystole. And glucose bolus is required in hypoglycemia at a dose of 2 milliliters per kilogram, and you're using 10% dextrose solution, which can be given peripherally. Higher strengths are to be given by central route. Now we can look at an example of a 6-year-old child with sepsis. If you are doing WETFLAG calculations for this 6-year-old child, you would write the weight first, which is double of age, which is 12 plus 8, so 20. So you will have all the subsequent calculations based on the 20 kilogram weight. Energy used will be 4 joules per kilogram, which would be 80 joules, or you might have to round up to 100 joules. ET tube required would be age divided by 4, which is 1.5 plus 4, so 5.5. But you might have to make available size 5 and size 6 ET tubes. A fluid bolus would be 20 milliliters per kilogram, so 20 times 20, which is 400 milliliters of normal saline. You could consider a smaller bolus in other situations. Dose of drugs, lorazepam would be 2 milligrams. Dose of adrenaline would be 2 milliliters of the weaker solution, and glucose bolus would be 40 mils of 10% dextrose.